Right, so I heard you describe the initial way the cancer was picked up, and you eventually were referred for chemotherapy first line and then surgery next.
Yes.
And how did you find the chemotherapy? Do you remember the chemotherapy drugs you had?
Yes.
I know they're hard to remember, these technical names.
Yes, I had FEC and Taxi.
Docetaxel.
Docetaxel, that's it, yeah, I had both of them.
How did you find your body tolerated them?
With the first one I had, I think that was the one that goes into your, syringed into your hand. Yeah, that was fine when it went in, but then you feel, sick afterwards, but I did have the anti-sickness drugs. I did feel really, first few days and that I felt bad, and then after a week or so on that I started picking up, but the only thing was after I'd had my first lot, when I went back for the second lot, my white blood cells hadn't come back up, so then I had to have the extra drugs to bring your blood cells back up, which meant an extra injection, which wasn't nice.
And were you attending the chemotherapy suite for the chemotherapy and staying on there for a few hours each time?
Yes.
And having the intravenous administration?
Yeah.
How did you find the environment with all those other people milling about?
I always took somebody with me, and I think it's important that somebody goes with somebody and sits with them.
That's a good tip, because it also accelerates time in a way.
Yes.
Because otherwise you just feel like it's a very long, drawn-out process.
Yeah. I mean, with the first chemo, you have a nurse sitting with you, which you can be talking to you, which is not so bad, but I always wanted somebody else there with me as well. And when I was having mine, the space was very limited, and a lot of the times they were saying, you can't have anybody with you and that, but I always managed to get somebody to sit next to me and be with me.
It's quite packed, but what you're saying is by request they will kind of accommodate it? If you sometimes yes, depends on what nurse you'd got on at the time, but I think now what I can understand is that there is more room and they are allowed to have somebody with you. Yeah.
But I think it is important that they have somebody there, especially when it's mine was only an hour treatment and that, but some people are there all day. They need people there with them. Because there was nothing else to do than talk to somebody. So, yeah.
Did you find any particular problems with the chemotherapy, even after it was finished? Any residual effects?
Well, after I had when I was on the second one, I was quite poorly with the second chemo. I had got an infection, and I had to go back into hospital. Because I collapsed in hospital with a water infection, which I didn't know. Because when you're on chemo, you do not know, you have that many pains and things like that. You don't put everything down to anything else, but the chemo, you think that's just, it's a norm.
Yeah, I know exactly what you're saying. You attribute every symptom to that.
Yes, so you don't think of anything else.
Yeah.
I mean, I was at home one day and feeling very hot and cold and not really associating that to a fever or a chills. And I collapsed at home one day, not realising that I had fell on the floor. I just thought I tripped, which looking back, I hadn't. It was the water infection that was...
So not only can you have a coincidental illness while you're having chemotherapy, but you're more likely to pick up something like an infection.
Yes, definitely,
and therefore it's wise to look out for those things. Yeah,
I mean, you should. I mean, when you're having chemo, you're told to take your temperature every single day, which you probably do in the first few weeks, 3 weeks, and then sort of like when it was on to my second lot of chemo, you sort of relapse and don't bother doing it so much because you think, well, I'm halfway through it and everything like that, and you don't look at your temperature charts kind of thing, and that's the big key. If your temperature's up, then you have to ring in.
Did you have any indication that the chemotherapy made a difference against the cancer?
I was seeing my oncologist quite regularly, and they were measuring it, although I don't know how it wasn't really measured that well because it was done with a tape measure, and I didn't really always have the same consultant, so how one consultant could remember from the next how big it was.
Yeah, there's some variability there.
You know, it was difficult, but they did say that it was shrinking.
That's good.